Good afternoon, everyone, and Assalamu alaikum as well. My name is Al Mustafa Adamila Usman. Here is Suleiman, and here is Harrison. We are part of the Retina Care movement, which is a medtech platform. Now, I would like to ask two questions and also give a little bit of 15 seconds for people that have actually lost their blindness. Please, for 15 seconds, can you all stop everything you are doing and wait for people that have actually lost their blindness? Yeah, thank you. In a situation currently in Africa and in Nigeria, we have a big problem when it comes to the healthcare aspect, which is not being addressed. We know that we are lacking in resources. At the same time, we know that we are going to school to study to become a medical doctor, and we end up not actually becoming a medical doctor, not because the platforms are not available, not because the hospitals are not available, but because of the inability to actually employ us. That is one. Secondly, there are many people out there today that are losing their eyesight due to either undiagnosed diseases or diseases that is not even known to them at all. Many of us here are actually making use of glass or having one or two eye problem, but we have not checked back. Is my lineage having any issue that can actually lead to blindness? No, we have not done. So now, Retina Care, your vision, our mission. Next slide, please. Now, someone in Nigeria is losing their sight to disease that will have been detected early, not because treatment doesn't exist, but because detection comes too late. Now I'm going to read out the statistics for you to know how the problem is actually deep in the society. According to Nigerian National Blindness and Impairment Survey, World Health Organization, Institution for Diabetes Retinopathy Research, and National Health Institute, 84% of blindness is avoidable. Yes, 84% of blindness is avoidable. That is one. Secondly, 3 million people who are diabetes patients currently in Nigeria are at the risk of blindness due to diabetes retinopathy. That is another one. Now, 1.1 million people currently in Nigeria alone have lost their sight due to glaucoma. And 4.2 million people are currently at the verge of losing their sight because of severe visual impairment. Now, which solution are we offering to actually solve this? Next slide. Next. Now the solution. Retina Care is a closed-loop eye care system designed to prevent avoidable blindness across Africa by creating a seamless connection between patients and licensed eye care professionals, making urgent eye care conditions like glaucoma and diabetes retinopathy easier to identify and act on immediately. Now, how do we plan to do this? We are combining four different things. One is a huge network of specialized eye care professionals that are licensed. That is one. Secondly, we are integrating what is known as artificial intelligence for health, for diagnosis, into this platform to assist the specialist for early detection of disease. That is two. Three, we are incorporating what is known as automated system. The automated system helps the patient to follow up on their health, especially the eye aspect. Then four, which is the last thing, is accessibility. In Retina Care, the platform is built to thrive around everywhere in Africa. So you are in Nigeria, you are in Kano here, on the platform you can easily book a specialist that is closest to your own location. You don't have to go to the hospital, stay in a long queue before you are going to see that specialist. You have a specific time. You have to meet me so and so time for your checkup. You book it, you go there, you get attended to, you move. After moving, it does not stop there. Every single thing that is being recommended by that particular specialist is going to be routed back to It's going to be routed back to the patient dashboard for easy follow-up. Next slide, please. Next. Now the market opportunity. When it comes to the total market opportunities, we are not only focused on the money. Yeah, there's money in health tech. We have 24 million market opportunity just for Nigeria alone. I'm not going to talk about Africa in general. Now we have 4.25 million serviceable addressable market, people that we can actually reach out to. Then we have the sum, which is the serviceable obtainable market, the people that we can easily offer our service to, which is over 640,000 people. Now, as we know, Nigeria is one of the most leading country when it comes to variables like glass for eye, or when it comes to what eye-related issue in the continent of Africa. And yearly, we generate nothing less than 9.27% revenue on that. So when it comes to the business model, we are offering what B2B partnership, B2C subscription, and what referral what fees as well. Next slide. Now when it comes to our attraction, now we know we can't do this alone. As I said, these are just the builders here in the UK. We have people across what Nigeria and Africa, medical doctors, specialists, optometrists, researchers, AI researchers on how this particular system is going to be worked. At the same time, we also have an acceleration program from what University of what Cambridge. They are focused on what? On helping and supporting what? MedTech platforms, which is still ongoing with them currently. That is for what? The traction. And we have also what? We are making partnership in Kano here. That is Aminu Kano and Hospital and Aqua and a healthcare what? Center here in Kano here for what? For further partnership and organization as well to get data sets for accuracy. Next. Now when it comes to the team, I myself am an AI and machine learning engineer. I'm at the same time an architect behind what? The retina care. But they have other people that are what? That are working on this. The medical doctors that are also what? AI and machine learning specialists. We also have what? The doctors separately. Now, this particular person who is the co-founder, Basira Musa, is a doctor of optometry in Bayero University here, Kano. So she's leading the team here in Kano, me and I. We also have what? This particular person, Omasiri Oji. She's in charge of what? The design aspects for the user interface for the platform. At the same time, she's also what? Carrying out what? Progress in Abuja. And we have other people around like that that are also making their own projects to make this come to life. So, that's what I have to say.
Thank you for your presentation. At least I learned some things from what you guys said. Thank you very much. So you, in the presentation, I asked you, even write it down, that 84% of blindness is avoidable and it's like it's avoidable, and you said it's not because treatment doesn't exist, but because detection comes too late. So retina care, what specific step like do you guys like approach or step do you guys want to take to prevent late detection to avoid blindness from people?
Now, as an average Nigeria, not having 30,000 naira to go to a private hospital without having to, you need to bypass the queue and the rest to get what? An eye specialist to take care of you for what? Full healthcare system. That is expensive. We cannot afford that. So at retina care, that is why we are offering what is known as what? Optometrists and ophthalmologists what? Freelancing. But they have to be what? Licensed by the regulatory body that is what? That is handling them. So they are onboarded on this platform. Anywhere you are, you can book them. We have huge amount of people in this network, which what? It cuts down what? The price. So at the same time, they also regulate the price. When it comes to the financial traction alone, we did the financial traction at the rate of 1,500 naira for specialist consultation on in-person. Just imagine, just for 1,500 naira, with the projection of just 1 year, it can come out as about 50 million. So the accessibility aspect, anywhere you are, anywhere at all you are, you can access what? An eye specialist that is going to attend to you without any limitation, within your own time.
Okay, thank you very much. My question is, have you tested the program, or what is the accessibility of it? And secondly, how does it align with the SDGs? Because this is our main concern.
So, retina care aligns with 3 Sustainable Development Goals, SDG 3. 10 health and economic goals, SDG 9 industry innovation infrastructure. Through SDG 9 industry innovation infrastructure, we are making use of artificial intelligence and also technology to make sure that the internet is accessible to all. Through SDG 8 decentral economic goals, we are increasing productivity, because when you lose your eyes, you are productivity, you lose it too. So we are empowering that productivity. And also through SDG 3, we are making sure that health is being detected early before it even goes worse.
So in addition to the question that you asked, and the SDG that he has listed, the accessibility aspect, we are trying to make that seamless, and the testing of the product as well. Now, when it comes to the testing of the product, this is not a project that one or two people can just work on. No, that is why we are making partnership with NGOs and hospitals. Now, part of the team, we have somebody that is known as Dr. Wali. So Dr. Wali is based in the UK, and he's an AI and machine learning specialist and also a medical doctor. This particular retina care will be tested first on his own platform. So we are not just creating something out of an idea, we are creating something that is practical.
Thank you.
So, let's start.